Today, I'm talking about the 3 most common things that cause ear infections in dogs. My name's Dan, I'm a veterinarian. I'm gonna start off with the most common one I see is bacterial. Bacterial ear infections are gross. They smell, they're goopy, it's like cottage cheese down there. There's some blood in it sometimes too. The ear can be all puffy and swollen, and when I go in there and swab it, it's just like dripping off there. For bacterial ear infections, and you're gonna see a trend here. Okay, I'm gonna cut to the chase. For all of these, I will do an ear cytology or an ear sample. I swab the ear, roll it under a microscope, look at it, and I'm gonna see the bacteria. Usually I see white blood cells, red blood cells, and little circular bacteria called cocci, or long ones called rods. Based on that, I can get a really good idea of what I want to do next. Do I need to do a topical antibiotic? Do I want to do an oral antibiotic? And hey, if it's really bad, do I need to culture this sucker and grow those bacteria and find out exactly which antibiotic to pick from? What is the most sensitive and the most effective? Number 2 would be a yeast infection. Yeast will cause more of like a thickening of the ear. It smells like...
It just smells, yeah, it smells gross.
Yeast infections, you can do an ear cytology. The yeast are gonna be these little things that have like a little head here and a little head here. It's like little bubbles. And last, but probably the most common one that people think their dog has in the ear is ear mites. A lot of people come like,
Dan, I think my dog has ear mites.
I'm not betting you guys. Like, I need to do an ear cytology. I need to swab the ear, put it on the microscope. If we're just guessing, we may be totally missing the treatment. So we need to do a cytology. We need to roll it out. And if we see ear mites, if we see yeast, if we see bacteria, we have our diagnosis then. We always need to do an ear cytology. That way we get our answer, and then I can pick the right antibiotic, antifungal, the topical, the mite med. I can do it with confidence then too. And yeah, a lot of you are probably like,
Dan, those are the 3 most common things that I see too. What about the underlying causes?
Yeah, definitely. There are definitely underlying causes, like allergies, environmental, food. Allergies are definitely a driving force that cause repeat ear infections. And when you go to your veterinarian, they will probably recommend something to calm the allergies to reduce the number of ear infections you have a year. Because the ear infection is actually infection, the infectious organisms. But the allergy drives the inflammation, which drives the potential for an ear infection. Hope this was super helpful, guys. Remember, getting a cytology or a sampling of the ear will help you figure out if it's bacteria, yeast, or mites. Please like and subscribe, and please share about your pet's ear infections.